2 weeks before camp starts, we have a week of leadership training where our leadership staff has extra training on how to care for children and how to keep them safe around camp. And then we have a whole week with our entire staff of where we train them as well. We are also all diversity and equity inclusion certified. And we have trainings like CPR and first aid. All of our counselors are CPR and first aid trained. We are mental health trained. And all of our lifeguards have lifeguard certifications and are trained extra on the CPR and first aid aspects of that.
We strive to be a very safe camp physically, so whether it is keeping staff in ratio, making sure that they are trained, making sure that we have nurses and medical staff on site should any emergencies come up, we are there. The piece that gets missed a lot in overnight camp is the mental health piece, but we know that and we are sensitive to that. One of the things that happens at camp is you open up and you discover yourself, but sometimes that includes things that you've been dealing with mentally. And because we make you feel so comfortable, we make you feel at home, a lot of those things come out at camp. We do offer mental health first aid training. We offer mental health awareness. So even if you don't get the mental health first aid, we make sure that we take the taboo out of the discussion of mental health because we want people to feel safe and feel like they can discuss those things with us. We also use YUSA's mental health toolkit to help counselors break down that conversation for our campers from age 6 all the way up to our oldest campers. So we want to make sure that our campers are physically, emotionally, and mentally safe here.
There's a lot of inherent risk at camp, and we try to mitigate that as much as possible, whether that's with staff training. So we want to train them to take care of the entire camper, both mentally and physically, as well as how to teach program areas, how to respond to homesickness, how to get them to the nurse if they need to. We have certified RNs and up that are at camp every single week. And then we have safety practices in place at all of our program areas, from wearing helmets at the challenge course to wearing helmets when they're riding horses, to making sure they're all wearing boots and long pants, or having certified lifeguards at the pool at all times.